Hello and welcome back to my channel. My name is Jaden and I am a dental hygiene student. Today we are going to talk about the 5 common mistakes you might be making in your oral hygiene care routine. To begin, I wanted to start by saying that all of my information is verified by the American Dental Association. If you have any questions, leave them down in the comments below and I will answer to the best of my abilities. Without further ado, let's get started. Number 1, oral hygiene mistake that you might be making is that you are not replacing your brush head. It is recommended that you change your brush head or toothbrush every 3 to 4 months. In addition, if you notice that your toothbrush bristles are frayed, you need to change it even sooner. That is because your toothbrush loses its capacity to brush your teeth efficiently. In addition, if you are sick, you need to change out your toothbrush or whatever appliance you are using because that toothbrush now has all of your sick bacteria on it and you do not want that in your healthy mouth. In terms of using a manual or electric toothbrush, that is completely up to the patient and their preference. I personally think that electric toothbrushes are better, but everyone is different. And as long as you are brushing twice a day for 2 minutes each, that's what matters. Yes, I just said 2 minutes. Majority of individuals do not brush their teeth for the full 2 minutes. So please brush your teeth the full time. That is how you are going to keep your mouth healthy. Oral hygiene mistake number 2 is that you are not reading the ingredients on your toothpaste. There are a variety of different toothpaste on the market right now, and it can be overwhelming at times. I recommend that you look at the back of the toothpaste bottle and see what kind of ingredients are in it. The first thing that you want to look for is that your toothpaste has fluoride. Definitely want a toothpaste with fluoride in it. There are 2 kinds of fluorides. There is sodium fluoride and there is stannous fluoride. They are pretty much the same thing. They both help prevent cavities. Stannous fluoride has been shown to be more effective, but they both work. Last thing I wanted to talk about is sensitivity, because a lot of people suffer from tooth sensitivity. Something that I recommend is that you get a toothpaste that has something called potassium nitrate in it. Potassium nitrate works by dulling our nerve endings, so it dulls the pain, and this way your sensitivity will be lowered. And it is a very common ingredient used in anti-sensitivity toothpastes. For example, this Colgate sensitive toothpaste has potassium nitrate 5%. In addition to fluoride, the other thing that you want to look for in your toothpaste is the American Dental Association Seal of Acceptance. This means that the toothpaste has been tested and approved for safe use. Oral hygiene mistake number 3 is that you are not flossing. There's something called plaque that forms on your teeth. Plaque contains bacteria, and when that is combined with acid and sweets and other kinds of foods, that is what causes cavities to form because it releases an acid, and the acid affects the enamel and starts tooth decay. So that is why toothbrushing is so important, because we need to remove this plaque before cavities start to form. There are 3 common steps in a normal hygiene routine. This includes toothbrushing, flossing, and then rinsing with a mouthwash. Flossing and toothbrushing are classified as mechanical removal, whereas mouthwash is considered an antimicrobial. Plaque can only be removed mechanically, meaning that you cannot rinse away your plaque. Also meaning you need to floss and brush. When you are brushing your teeth, you are not able to reach the interproximal, which means in between your teeth, easily. This means that you need another way to clean in between your teeth. This is a common site for cavities to start forming because plaque is still being retained there even after people brush their teeth for the full 2 minutes. When plaque is not removed, it hardens and it becomes something called calculus or tartar. Calculus cannot be removed mechanically at home. It needs to be removed professionally by a dental hygienist, and that is why you come in for your cleanings. Mistake number 4 is you are not using products that are personal to you. Everyone's mouth is different, everyone's anatomy and tolerance is different as well. This means that not everyone can use the same products. There are a variety of different floss appliances that you can utilize. String floss, dental flossers, the water pick. If you do end up using these, I highly suggest that you either use multiple for your whole mouth or that you rinse off the string before you start going to the next spot, because if you are using this and removing plaque from in between one tooth and then you're just moving to the next one, you're going to be spreading that bacteria. So I suggest that either you use multiple or you rinse it off after each use. Another way that people are not personalizing their oral hygiene products is if you feel like you have dry mouth or you feel like you're not producing enough saliva, then do not use a mouthwash that contains alcohol. Alcohol will dry out your mouth even more, and so I suggest that you use a product from ACT or Biotine. Oral hygiene mistake number 5 is that you are immediately rinsing out your mouth with water after you brush your teeth. To receive the maximum benefits of the fluoride in your toothpaste, you want the toothpaste to sit on your teeth for 4 minutes. Most people are brushing for only 1 minute and then immediately rinse your mouth out with water when you're finished. Those fluoride benefits are getting literally washed down the drain. It is important after these 4 minutes to rinse your mouth out because you do not want to swallow or ingest the fluoride. I'm not saying to not rinse, I'm just saying to wait. Bonus tip, please, please, please brush your tongue at the end of your routine. Tongues have so many grooves and depressions that are the perfect housing for bacteria. The main cause of bad breath is from inadequate tongue cleaning. So please brush your tongue and your mouth will feel a lot healthier. Okay, that was it for today. I hope you enjoyed my video. Please leave comments if you have any questions about anything at all that I said. I would be more than happy to help. Let's start off the new year with improving our oral hygiene routines. Thank you for watching. I will see you next time.